This is a very difficult case that I had recently. It's a patient with a non-maturing fistula in the left upper extremity. As you can see, the arterial anastomosis was a surgical fistula, and the arterial anastomosis here is a radiocephalic fistula, but it's not maturing. And the reason it's not maturing is because this part of the vein is very atretic. What I usually do in this case is I use a 3 French catheter and I put in the brachial artery so I can do an arteriogram and I can have an idea of the arteries and take a look at the veins without getting any spasm. And that is what you're seeing here. We then get a second access in the cephalic vein towards, usually in the upper arm, I usually do to avoid spasm. And then we access towards the arterial anastomosis, which is again right here. And you can see this whole segment is pretty atretic, not developing. And then, as we normally do, we dilate this area with a balloon, having a hard time to dilate, very close to the anastomosis there. You can see an arrow in here, but we dilate. This is a 1/8 balloon that we're using. And then right after we do an angiogram, and what you can see is a perforation in this area, which is right next to the arterial anastomosis. So a tough situation. So how do we handle that? The other issue is I was able to get a wire here, but because the way that the arterial anastomosis was done was very hard to get a wire going proximally into the radial artery. I couldn't just put a stent across this area would occlude the inflow of the artery. So initially, I put a balloon here to obviously occlude the flow and prevent more bleeding.